Will you be sure to make me a host so I can share?
You're good to go.
Yes, ma'am. I don't know that you have to be a host, but
If the permissions are not turned on for participants to share, then someone will have to be made a host.
I mean,
It looks
everybody,
like I can do it.
yeah, everybody shares from their own computer, so I don't think that's going to be a problem.
All right. Well, it looks like everyone's here. Are we missing anybody?
No, looks like you're all there.
Okay, awesome. Well, we'll go ahead and get started. I've been looking forward to tonight. This is the presentation of the task force recommendations, and the task force, in my vision, were comparable to the mayor's roundtables that I have, where I get feedback and get ideas for things to work on. And so Councilmember Bierman's really carried a lot of water with her work on this specific initiative. So I'm happy to contribute a tool to the toolbox. So as you all know, these are simply recommendations. I can't decide anything unilaterally, but I will say I really did enjoy the process. Like the roundtables, I find it really rewarding to connect with residents. We had an amazing task force. We had to stop adding people at 50 people because we wanted it to be productive. So I'm going to share my screen now and walk you through the process. But before I do that, I just want to take a moment and thank all of the task force members for their time. It's a busy time of the year, and they joined without hesitation. They knew it wouldn't be a long-term commitment, so that probably helped. But I really appreciate that feedback again from the community on where our needs are, because we don't have all of the answers. We have our own, I think, unique experiences, but I also hope that these recommendations will be the continuation of what needs to be an ongoing conversation in how we decide to allocate funds. So I'm gonna share my screen now. All right, can everyone see it?
Yes.
Head nods. Okay.
Yes.
All right. So I've already done my opening comments, but isn't that a lovely little collage of photos that they put together for us? So the process, put together a task force to get feedback from a variety of different agencies and residents to again have conversations about how to provide optimal police and social services. We asked management partners, a local government consulting firm, which Norman has used in the past, to help us. And we had 5 sessions, and they helped conduct some research. And I will apologize now. We gave until noon for the task force members to provide any feedback on the report that I sent out around a little after 5. You'll have obviously more time to go into it, and we're going to cover all the recommendations in detail, but they did an excellent job. And so as it says, we have representatives ranging from the different churches, different law enforcement officers, different nonprofits, different advocacy agencies. It was a really great pool of residents come together and spend their time working on this. So here's a glimpse of all of the people that were involved. So there we go. Now, I'll let you guys look at this. I hate it when people read slides to me. But again, all the sessions were via Zoom. And because we were such a large group, we ended up breaking into smaller groups and then coming back and reporting in bigger groups and different breakout groups. So on a side note, I really enjoyed management partners' ability to facilitate Zoom meetings with such a large group. And they all even provided instruction slides for those who may not know how to raise hands. And it was a good experience. And I thought they did an excellent job executing it. So the task force recommendations are as follows. Let's just dive right in. I've invited some people that served on the task force and some that didn't, but have information that I think is relevant to some of these recommendations to join us. So I don't know if this order got switched, but creating a physical hub for the social service agency collaboration. So one of the things that came up was we had a lot of different nonprofits and people that deal with social services, and they weren't always talking to each other. And so people were kind of surprised that some of the stuff that needed to be happening was happening. And so we thought about a physical space, which right now the equivalent I could think of would be City Hall, where they then get pointed in the right direction, the library when it's open and functioning, or the community services building, which isn't a one-stop shop the way we were envisioning and is an aging building. So I honestly don't know the future of that community resource. But where people could have the, like what we do with the homeless, where we get the driver's license and things like that, could be held there. One-on-one sessions, like a shared workspace when you're not in a pandemic, could be held there. Joint events for social service agencies could be held there. And so, you know, all of the literature from all of these places could be held there. Because there's a thing that kept being brought up was we don't know where to send people. So some sort of physical space was recommended, again, to help be a one-stop shop that we could send residents who are in need, and it would be faster to provide services at that time. This next one is very important because, again, I don't think many residents know what is being provided, and we live in an age where you've got to provide information on many different formats. And so publicizing existing service options for community members. I know that United Way, we tend to push everyone there, which is helpful, but then it got brought up, well, where do I go for services, but where do I go to volunteer? And it was very elaborate, and I thought that was great. And so we talked about perhaps putting something on the city's website as well, because as you know, we just got a brand new city website. And so I invited Tim Powers, our IT director, to answer any questions you might have about that. Expand services using multilingual resources, obviously important. We've been working on that, I think, more recently with the census and COVID-19, but we need to keep doing that in all areas. And you see, like Austin, their mayor does a fantastic job of everything is bilingual. It's post in English, post in Spanish. And obviously we have more than just English and Spanish speakers in Norman, but that was seen as a need where we really need to build up on that. Expand, and I'm going to turn it over to Teresa Capps now. She can jump on number 4, which is expand the hours of current mobile crisis service units. I don't know if based on council's conversation, and it was educational for me as well, there are mobile crisis service units thanks to the state resources that we have in our community. So Teresa, if you want to kind of take over and explain what those are and what they do and how we could better support that existing service as well.
Good afternoon. I'm Teresa Capps, and I am the Division Director at Central Oklahoma Community Mental Health Center on Alameda. I'm the Division Director of the Children's Services, but I'm also the Executive Director of the Children's Recovery Center, and that's a 55-bed hospital at roughly 12th and Alameda. Serves the state. Our mobile response services occur both on our child side and also on our adult side, and those services are out of the Alameda campus. Let me first talk about the children's services. Those children's mobile response team services have been happening now for a little over 2 years, very robustly. We've had that service for a while, but about 2 years ago, we were awarded a grant from the Department of Mental Health and Substance Abuse Services, and it came with a nice contract that requires us to respond to calls that are placed from any community member in Cleveland or McLean County, and those community members get to define what their mental health crisis is. We don't define it for them. They call us, and the call goes to 211 or Heartline. And basically an operator, I like to think about it as sort of like a dispatcher. They take down information related to the call and determine whether or not the caller wants an immediate response, or if they want more information, which would be like a deferred response. For the immediate response, we have an hour to respond. And think about that in pre-pandemic terms. Previously, that was, we would get in a car and go. And after, for the deferred calls, we have 24 hours to respond, but usually we don't wait. We just talk to them immediately. We have everything from minor behavioral disruptions all the way to really serious overdoses, where we have to call for assistance from law enforcement. Our age range is pretty remarkable. We go from 0 to age 24. In federal language, adolescence ends at age 24 because of the transition age of young people. So our program ends at age 24. So think about our community and what that looks like. That includes the University of Oklahoma. 2 weeks ago, we were on campus responding to a crisis, on campus virtually at this point, but on campus responding to a crisis. And there are other campus locations in Cleveland County that we've also responded to. On the adult side, they have a similar program. They're, we're a little bit ahead of them, but their program, they operate right now 8 to 5. They work closely with law enforcement, so they accept phone calls from the community. They accept phone calls from our own consumers. They accept phone calls from law enforcement requesting assistance and vice versa. They could be involved with a crisis with a consumer, a mobile call even, and request assistance from law enforcement. Certainly their hope to expand to 24 hours a day, and it's staffing right now, that's the limitation to doing that. We had long hoped, our children's team has telephones, and we have 2-in-1s, and the ability to do mobile response, virtual response. And we had done a little bit about doing that prior to the pandemic, but I will tell you that the clinicians' hearts, those are hard to move from having a person in front of them to seeing a person virtually. And the pandemic helped us really jump that hoop. And so now all the responses are virtual, and I won't be letting them go back for a number of reasons. I think our partners in other parts of the state have always done this service virtual. In the north part of the state, they've given out literally 1,000 iPads through law enforcement, through their community mental health center, through sheriff's offices, where people are able just to automatically call for assistance whenever they need assistance. They don't have to go through an operator. So that's a really beautiful model. And I wanted to go closer to that model. So the pandemic has helped us. So right now, the children's side, we respond to all of our calls virtually, and with really very few problems. We're certainly blessed in Norman to have a lot of devices in kids' hands. It gets a little harder, I think, when we go south, but we've even still been able to do that. The shelter, the Crossroads Shelter has purchased the device. The group homes have devices. The detention center has devices. So that's been a really great asset. And I think the model is a similar model that they hope to do eventually on the adult side.
And Teresa, if I'm remembering correctly, didn't you also just get a grant to buy more devices?
Yes.
Could
yes.
you expand on that? Which is one of our recommendations.
I wish I could say it was 1,000, but I will say that it's 409. I got the exact count. So 409. And those devices, right now they're working on what that will look like, which ones, iPads, telephones, hotspots. They'll come with hotspots. And they're working on a list right now of our current consumers that could benefit from that. And we see the more that we can take on with people in our community that we can serve that have mental illness and substance use disorders, the more that we can take on, then hopefully that's taking a load off of our police officers and sheriff's department officials in our communities.
Awesome. Does anyone have any questions? Now that I'm sharing my screen, I really can't see anyone. So far, before we move to the next 5, we've kind of reached the halfway point.
It looks like Councilmember Holman has a question or comment.
Just to clarify that you mentioned that this particular program, the age limit is 24, is that right?
So for the children's side of the program, it's 0 to 24, but on the adult side, they go up to senior adults.
Okay, thank you.
And just for advertising purposes, if anyone wants to share this number, you're welcome to do so. 833-885-CARE, C-A-R-E. And I think that's 2273, if I'm not mistaken. I don't call it. But that is a one-stop number for the 0 to 24-year-old population. And I think, Mayor, if I could take one more second,
Of course.
on the children's side, the University of Oklahoma is our partner for data evaluation. They help us with the infrastructure between the caller and the mobile response team. And so they're the ones that houses all of our, the crisis, the definition of the crisis, who's calling, different kinds of safety measures that we track for the event that we're going to someone's home. And they also do satisfaction and data analysis. So we're, like I know what our diversion rate is, for instance. I know the outcomes of cases. We don't let go of families until we have them stabilized in a setting, whether that's a hospital if it has to be, or outpatient services, or whatever their need is. We have it stabilized before we let go of the family. That's a really great partner and a way to measure our success formally.
Awesome. Well, I'm hoping that the city might be able to partner as well, because I'm sure you can attest to a theme that kept coming up with resources that we currently have. They exist, but they need more funding. And that is, again, a recurring theme we heard about all the services that were mentioned. What are your current hours of the current mobile crisis service units?
So the children's team is 24 hours a day, 7 days a week, 365 days a year, never stops. Like right now, as I'm talking to you, there are 2 calls going on. One is at a facility off of Flood. One is at a facility in McLean County, technically off of Highway 9. But both teams are working 2 crisis situations right now as I'm talking to you all. On the adult side right now, it's still 8 to 5, Monday through Friday, but they hope to expand those hours.
Okay, so that could be an area that we're referring to in number 4. And then with the identifying resources to expand telemedicine, that 409 devices is definitely a great start there as well. Thank you for being here, and please stick around in case we do have questions as we continue discussion about the recommendations.
Okay, Councilmember
Appreciate you,
Hall.
Teresa. Okay.
Mayor Clark, Councilmember Hall has a question.
Okay.
Thank you, Ms. Capps, for your presentation. How long have you all been in existence?
So the Community Mental Health Center on Alameda was established in 1969.
Okay.
We're a state-owned and operated community mental health center. The hospital as well is a little younger than the Community Mental Health Center. But all of the facilities on that corridor, Griffin Memorial, the Children's Recovery Center, and Central Oklahoma Community Mental Health Center are all state-owned and operated facilities of the Oklahoma Department of Mental Health and Substance Abuse Services. The Mental Health Center is believed to be the first in the nation, established under following the Kennedy administration's funding for services near people's homes. If you guys can recall a family member that had a developmental disability, and they wanted to have services for people in the United States that were closer to homes. And that's also around the advent of really important medications for our work that allowed transitioning of consumers back to homes and for treatment in the community. And while there were lots of hiccups with that process, it was still an important piece of why we're here where we are today in the delivery of evidence-based and promising mental health practices to our consumers.
And what is your primary funding source? Is it state funding or a combination of things?
It's a combination of things. So we do get state funding, state appropriated funding, but we also are required under the law to bill for our services. So we get billing through Medicaid, Medicare, third-party insurance providers. For families that have no insurance carrier, we also waive fees. We're required to charge fees, but we can also evaluate financial need and waive fees. And no one's refused services based on inability to pay.
And then can you give me just a rough idea of how many children you treat in a calendar year, a month, whatever you want to pick?
Well, it's hard to do outpatient, but I can tell you at the hospital, we treat about 700 children a year.
Okay.
For mobile response, and we've had an odd year this year, but because of the pandemic. But for this year, we had a little over 300 crisis calls to our crisis line. And then I have around 20 outpatient staff, and they all carry caseloads of around 50. Those are pretty busy people. And so cases come and go. But you can imagine kind of from there how many kids we're serving a year.
Yeah. Okay. Thank you so much for providing.
Sure.
Okay, go ahead.
Councilmember Behrman?
Hi, Ms. Capps. Thank you for your presentation. I really enjoyed hearing more about what you do. And I only have one kind of quick question, which is approximately how many calls for assistance from NPD do you get every year?
From Norman PD?
Yes.
So I think I don't know that I think Carrie's on the call. I don't know that I would couch it that way necessarily, although we have. I think for us in mobile response team, it's opposite. So we have the caller and we're working the crisis, and we call, generally we call for CIT. We had a really serious call over the weekend actually, and we just called and asked for CIT and worked just directly with a particular CIT officer. More commonly, our partnership with Norman Police has to do at the hospital. So in the community, when someone is in crisis in the community, we're the identified site, one of two in our community, the identified site to evaluate children. So Red Rock and Griffin Memorial evaluate adults that are a danger to self or others, or potentially a danger to self or others. And for children and adolescents, the Children's Recovery Center is responsible for that. So multiple times a week, we could have contact with Norman Police regarding children in our community that are in crisis.
Okay, so if I understand this correctly, it more often happens that you contact NPD. It doesn't happen so often that NPD responds to a call and it turns out to be a mental health crisis, and they call the mobile crisis unit for assistance with that. It tends
I
to
think
happen.
that's just my experience so far.
Okay.
Doesn't mean that we couldn't change that.
No, I was just trying to make sure that I understood exactly kind of how the process works. So, it's hard for us to kind of consider where to go from here if we don't really know kind of how the relationship and how the partnership functions.
Right.
Now, so.
Well, we know all of the calls that come to the crisis line.
Mm-hmm.
All those people are in crisis. And so we're going to try to take care of those ourselves and divert or arrange for services for every single situation that arises. And it only gets to the point where we have to call law enforcement if we know, for instance, I can tell you there've been many calls where we believe that someone's about to walk in traffic, or someone has already overdosed, or they're overdosing, or their threats are so serious and they're refusing to cooperate with our suggestions. Maybe even their parents are, honestly. And so that's when we certainly call for support.
Okay. No,
We
I really
also,
sorry, Chief Foster, I didn't see it pop up.
we refer them to the care number that she mentioned earlier. We will give that to people to call them directly. So we're out of that picture, and they can call that care number directly and get started with whatever assistance they need from them. And the other way is if we transport them, like she was talking about, for their assistance they need.
But it doesn't happen so often, Chief Foster, that you are responding to a call, you identify this as either a child or an adult in need of simply just mental health services. But it doesn't typically happen that you call then the CARES number or the mobile crisis unit and say, hey, this actually seems like a call that's more in your wheelhouse than ours, so we're calling it into you. And have you?
Yeah, we give the people the number, and the
Sure, but once
person
you're
in
already on
crisis
scene,
calls.
once you're already on scene, you
Yeah.
don't typically call the mobile crisis unit to
No.
come and handle it. Okay, appreciate it. Thank you.
All right, so great questions. I think it's definitely an example that before we start making decisions, very, very important ones, we need to get clear on what exists in our community and how it all works together. And so that was, again, one of the reasons why I found this process incredibly helpful. And I hope that council members can see it, those that were involved as a resource as well, and consider this just a starting point for a very important conversation. So talking about the police officers, we had several recommendations, and I am going to let Chief Foster, who did not participate, but Lieutenant Bryant, who did, because he works so closely with our residents that are having issues with homelessness. And I'll let them talk about the first two. I will throw out, kind of jumping ahead a little bit with this third one you see here, identify resources to reinstitute the Juvenile Intervention Center. So I was surprised at how many of our agencies that deal with social services brought this up. Like, it wasn't suggested by me or anyone that had worked with like NPD. This is a hole that I'd like, and I'll be honest with you, when I started engaging in local government, this was on its way out. And so I don't know a lot about it, and I don't know the cost of it. I don't know what potential substitutes could be, but that was something that kept getting home. And I don't want to say amazed, but a lot of our recommendations went towards obviously mental health, but promoting the services we have. And they involve children and families and neighborhoods as a way to, I think, strengthen our community. So I was really impressed with that. And we'll dive more into that, but I'll turn it over to Chief Foster and Lieutenant Bryant to talk about augment police services with a range of social service providers and identify policing approaches for officers in soft uniforms, which is also a phrase that I did not know before this process. Soft means like street clothes. So Chief Foster, Lieutenant Bryant.
Okay, on the first one, on augmenting police services with social service providers, we do several things with social service providers, which you hear. We do the Homeless Expo, which brings in a lot of providers into one location, like the center you was talking about. This brings all those services into one location for the homeless people. Lieutenant Bryant organizes that. We also work with others like Salvation Army, Food and Shelter, even Meals on Wheels, and getting housing up north there for students that may need housing while they still are going to school. We partner with a lot of them, and a lot of our people are on boards. But one thing that we did talk about that had been brought up was a program with the mental health group, and I'll let Lieutenant Bryant tell you a little more about that. We looked at it a couple of years ago and how that went and where it's at now. But
okay, thank you, Chief. I'll pull this down a little bit. I know it makes me look better if I have it on, but I'm the crisis intervention team coordinator for the police department. I've been a CIT for 10 years, and I've been a CIT instructor for the Oklahoma Department of Mental Health for 8 years, and I've been the coordinator for about 3. We have 55 CIT officers and 8 CIT dispatchers within our police department. And working with the different providers around town, we have worked very hard as an agency to collaborate. And the key word that I'm going to talk about in this whole thing is collaboration.
Lieutenant Bryant, before we go any further, for those watching at home, can you describe what CIT is, please?
Oh, I forget. I'm sorry. It's Crisis Intervention Team. Briefly, it's the Memphis model of crisis intervention. We've heard about that, and it is a specific model of crisis intervention developed by the Memphis Police Department in 1987. We've used Memphis model of crisis intervention in Norman since about 2004. Oklahoma City brought it to Oklahoma in 2001. So I do teach that for the Department of Mental Health. I'm an instructor. We have all these officers who are trained in the Memphis model of crisis intervention. Basically, what it does is it gives the street officers, additional training in mental health disorders, in mental health law, substance abuse disorders, and co-occurring children's disorders, and we talk with providers. Providers come out and they visit with us, and we get to know them and they get to know us. And Teresa Capps and I have worked for many years together on a lot of issues. And what she's talking about as far as mobile crisis is a game changer for us, because that gives us even more direct access to mental health providers to help those that we're dealing with in the community and bring those services straight to them. Over time, I've gone to many different conferences and talked with different agencies around the United States, and collaboration has always been the key. Working with mental health, partnering mental health facilities and mental health providers with specially trained police officers, in this case, CIT officers. And so last year we started looking at a model of a multidisciplinary team and called it the Behavioral Health Response and Treatment Team. It's still very much in its infancy. It's a concept at this time. We've had several meetings with different providers on adult mobile crisis for adult providers. We hadn't really gotten into the juvenile side yet. And we were really going great guns, and then COVID hit, and everything kind of, as you know, kind of shut down. So it's still out there. It's something that is very much needed within within any community, really. Anytime that you can put law enforcement and mental health consumers and mental health providers together, we can have some great outcomes. And the idea is collaboration. The idea is understanding. The idea is communication. And we have some very, very great partners, not only providers with COCMHC, that's Central Oklahoma Community Mental Health Center, Griffin Memorial Hospital, CRC, Norman Regional Hospital, but also with the judiciary. And that's a big part of the partnership as well as in the judiciary. Judge Tupper with the treatment courts, Judge Napoli, who works with mental health civil commitments. They are fantastic partners, and having them in your Rolodex is really we can make a lot of stuff happen. So we put this together in draft form. We haven't come up with any specific. We're still going back and forth with it, but it is a collaborative model that we are working on, based on the problems that we have within our community, taking those problems and then working model for that. So many times there's so many models out there, and there are great models all over the United States, but you just can't take that model and then overlay it on your problems. You have to recognize your problem, you have to define your problem, and then you use that model to solve your problems that come about. So this is still very much a work in progress. And as you can see under paragraph A, are they able to see that?
No.
Okay. We do have 11 different partners that we work with, and to include the University of Oklahoma, the Zero School of Social Work, the Goddard Health Center, Cleveland County Detention Center, and their programs there that they have, that the Sheriff's Department has there, which is fantastic. The District Attorney's Office, Drug Court, Mental Health Court, Misdemeanor Recovery Court, and we are a part of or have contact with all these different entities, and these are all partnerships back and forth. So we have a very well-rooted contacts with all these different agencies, and I think it's something that we can make going forward a very good program out of it.
Thank you, Lieutenant Bryant. And council members, and again, my apologies for sending it out so late. You'll see on pages 4 and 5 of the report that we sent out, the specific models that the task force did look at. Cahoots, which Councilmember Bierman did an excellent job of diving into and oversight, was one of the models. And one that's not on here, because I think it was more, because they had homework, it was fun, was the county, the San Antonio County.
Yeah, Behar County and San Antonio Police Department.
And so they had a model. Would you like to tell us a little bit about what that is?
Yeah, that's a model, and it's been if you go to NPR and some other outlets, they've done some really good reporting on it, as they have with Cahoots and the rest of them around the United States. It's a collaborative program with the law enforcement, in this case San Antonio Police Department and Behar County Sheriff's Department, and their local mental health facilities through grants, 501c3 funding, many different funding mechanisms to actually put law enforcement officers on the street working with mental health consumers, but not in a patrol function. They have a specialized mental health unit in San Antonio, and they go out and I guess this is probably the best time to look at the next thing on your list, Mayor, is the soft uniforms. What they do is they go out very much in what I'm wearing, a polo that shows the police department, 511 pants, something that doesn't look as aggressive as just a standard patrol uniform, but yet still shows that, hey, we do have some authority. So it kind of gives that softer look. They've also been known to go out on bicycles. They've been on bicycles. I've talked to some of their officers who have actually done bike patrol, working with the mental health community. So they took what they knew was the problem in their community and said, okay, what resources do we have to address this problem? And that's kind of been the way everybody's looked at it from then on. Even those that have taken specific models, they have changed it to fit their needs in their community. So anything that we look at, we have to adapt for our community that's going to be the best for our community.
I completely agree. And I'll say it again, these recommendations are just kind of a continuation of a conversation that has been started. I do want to make sure whatever is decided upon and allocated funding is a good fit and utilizes everything that we currently have. And as you touched on, communication and collaboration. So again, it's page 4 and 5. We looked at 8 different models, but including the San Antonio model that Lieutenant Bryant just sent out. It's not on here, but I can email out a slideshow I found online that talks more about it, because apparently that has been modeled in a lot of places as well. So fortunately, we don't have to reinvent the wheel. We just have to customize it. So I think that's a great starting point. And so next, could you guys dive into a little bit of, oh, sorry.
You have 3 hands raised.
Okay. Then
Says Councilmember Holman.
Well, I wasn't sure if they were actually finished, if we wanted them to go through it and then ask questions or not.
Well, the Juvenile Intervention Center is a smidge different. So if we want to dive into this, so if we can just hold off on the Juvenile Intervention Center questions and focus on those 2 bullet points, I think that'd be fine.
Okay, yeah, well, I'd just say I do really like the idea of the soft uniforms approach. I've seen the Crisis Cops on HBO, I think it is, on Amazon. And they were wearing like jeans and a polo, and they did carry a weapon, but they kind of kept it under their shirt a little bit so it wasn't as visible, which was something they talked about in the show as being helpful for them. But I was thinking about the I might have to come back to mine actually, so if anybody else wants to go ahead.
Okay, Councilmember Peacock, you.
Yeah, my question was kind of along those same lines as Councilmember Holman. I was just curious what kind of equipment an officer would wear when wearing this soft uniform.
Yeah, we would still wear a soft uniform. We can wear a soft uniform, but it would be like this, where we're still identifiable as police officers. So if action has to be taken, there's no question about that we're police officers. And it sort of goes along the line of when there is something that happens with a police officer, like an officer-involved shooting, the first thing we do is take a picture of them to show what they were dressed like and how they would be identified. So while we can dress softer and like Councilmember Holman was talking of possibly covering the sidearm and cuffs a little bit with your shirt or something, that's a possibility. but we definitely want to be identifiable when we're out there.
And so
And
you
one
stood there.
thing I might add also is with CIT, and if you talk to Oklahoma City officers, mental health consumers in Oklahoma City and in Norman have gotten to a point where they look for that CIT officer. They, even though they're in full uniform, they know what CIT is and they know that they can get help there. So it's a culture change that we are looking at CIT. We're not looking at the uniform, we're looking at what the uniform can do. And the term CIT for a lot of mental health consumers is paramount. And organizations such as NAMI, the National Alliance on Mental Illness, who was a charter sponsor for CIT in 1988, has been fantastic in saying, hey, CIT officers are here to help you. And now we get mental health consumers and families asking for CIT officers.
And I think that's great. I mean, that's exactly what we're after. And I guess my question kind of is, you know, if somebody is seeking out that that crisis intervention officer, do they still have the same, aside from the polo and the pants, do they have the same physical outlook? You know, the sidearm, the cuffs, the pepper spray. They have all that loadout still.
In the soft uniform, they're probably going to have their sidearm and they'll have handcuffs. They won't have a lot of less lethal with them, but they will probably have a radio if they're dealing with a situation where somebody else could respond that if they needed a less lethal situation. Majority of times we can use de-escalation techniques to talk several situations down. And I could talk to several situations that had happened or has happened around the nation that definitely wouldn't have happened here just because of the way we handle things and the way things would go here with how we would engage in conversation first, or try to contact the people in a different setting. There's no need to push a confrontation. And a lot of situations that you see around the nation would not have been handled like it was there if the situation was here, which we can give you several examples of things that have happened here and had positive outcomes.
No, I think there's a lot of truth in what you're saying. So I appreciate you guys being cognizant of that, definitely.
Councilmember Hall.
Yeah, I'm also glad to learn about what the differences is and what, you know, how you define soft uniform and the kind of equipment that you're carrying and that sort of thing. So that's been really useful information to me. I have watched Lieutenant Bryan in action, particularly as it relates to our homeless population. And I was just wondering if you could explain to me, I know that you have acted in the coordinator and collaborative role for many years with a lot of our social service agencies in Norman. And so what do you see the strengths of the continuum of care model and how it could be applied to addressing what I guess you all have identified as a need going forward as we look at all of the different recommendations that we've listed so far tonight? Like, what are the strengths of how that works for you that you think could be applied to better collaboration and coordination now?
First of all, nobody tell Michelle Evans I'm talking about continuum of care without her here. No, Michelle does a fantastic job with the continuum, and I've been a liaison to the continuum of care for about 3 years, and it's been a very rewarding part of my career. And that's really what did the final sell job for me on collaboration, of what collaboration can be. And the continuum is collaboration. It's just under certain guidelines it's put forth by HUD. I will never say that I know all the ins and outs of how the COC works. I'm just enough to be dangerous when I talk about it. But they do fantastic work, and I think that shows what we can do as a community. I think it shows the organizations and the people that are in this community that truly want to help. And we're talking about the most vulnerable members of our community, both juvenile and adult. And when we're talking mental health, they don't have to be homeless. I mean, we're talking vulnerable mental health consumers in all 8 wards. It doesn't matter. Mental illness doesn't know status. Mental illness doesn't know how much you make. Mental illness doesn't care. It affects 1 in 4 in Oklahoma equally. And when you talk about 1 in 4 in Norman, that's a lot of folks. So I think we have to have the collaborative efforts. We have to continue working as law enforcement because we're on the streets. We are out there. We're out there in the public every day. But when you're talking about all these different agencies, they can't put that number of people out there, but they can access us and we can access them. So there's a synergy there that really has to be taken advantage of.
And Councilmember Hall, I'll jump in. If you look at number 9, it's highlight and facilitate greater interagency collaboration. And that the COC was a model that was pointed to, because as Lieutenant Bryant just pointed out, yes, there is a lot of overlap with mental health and homelessness, but sometimes there's not. And so agencies that may not focus on the homelessness piece as much may need to have their own COC type thing. So that was brought up. It also threw out maybe a social services roundtable where that's all that we would sit around. So again, the mayor could be on top of what's happening and they could share resources. But then a concern that was brought up was, will we be duplicating resources? And how big could this be? So that is something, and why it's a recommendation. Because jump in.
Yeah, Mayor, if I can, we have a similar organization right now in the Cleveland County Mental Health Task Force. This was started some years back as a program with the Oklahoma Department of Health, talking about obesity, substance abuse, tobacco use, and mental health. And we started this program, this study, and then we morphed into the Mental Health Task Force. And it's a public meeting. It's the second Friday of every month. We bring all of those people together and talk. Sometimes it's not as many as some other months, but it allows us to number one, talk about what we're doing in our organizations and how we can work more closely together. And I think some of the partnerships that we've been able to form out of that have been invaluable.
And didn't Bonnie Peruzzi, she's on vacation, otherwise she was going to present on this as well, talk about a group that was collaborating, started in the 80s, and then it kind of fizzled out? That was a similar, do you recall what that was?
It was very similar. That was the social something or other. She's more elegant about talking about that than I am. She has the institutional knowledge of mental illness and mental health treatment in Norman. I could never even come close to that.
The team we've been working on.
She was one that shared concern. Or she was the one that was one of the ones that was from the agencies that work in this area that shared concern about, okay, don't give us one more meeting to go to if it's not going to be helpful, which I totally understand that, given how stretched then they are in time and their own mental health, dealing with everything, and the financial burdens as well. So that is something that we should flesh out before moving forward. But Chief Foster.
Mayor, I would encourage you and all the council to attend the October meeting via Zoom. And I can forward that to Brenda Hall if she wants to send that out. I would encourage all of you to attend. It's a public meeting. There's no invitation necessary, and just to kind of get an idea of what we're talking about.
The team that we are working on currently that he talked about earlier is the behavioral health response and treatment team that we collaborate with people on. And keep in mind, we're also involved in the court side of this, as Carrie mentioned earlier, in the mental health court and the drug court side, to try to pull people out of those, out of the court system and get them back on their feet and headed in the right direction. So we look at several different options on getting people out of the court system and the criminal justice system back on their feet and headed in the right direction with the assistance they need, whether it be with housing or mental health or medical or whatever it is. We work with several agencies to try to get them that assistance.
So do you work with, I think people get confused about social services and social workers. So I think one of the models that we had seen was social workers would be out, but I was kind of surprised to even hear participants in the task force have concerns about that model. So can you tell me again, how much do you work with social workers, not just agencies?
Specifically with social workers, and when we're talking social workers, we're talking a wide and varied group of disciplines. The majority of the ones that I work with are licensed mental health professionals or mental health professionals, rather than what we would term as specific social workers. But I think we can probably say anybody that deals with people and the needs of people can be put into that.
Because my mom was a social worker my entire life. She could always tell how long she'd worked there by how long I was alive. And so I think, yeah, it's a very broad definition of social worker, but you did mention the Zero School of Social Work.
Right. And that was one of the partners that we were talking with at the very beginning, particularly on the data collection side and some training issues. One thing that I will tell you, you were talking about agencies versus people, and that brings in a very big issue in the fact of privacy, that we deal with a lot of agencies that we cannot be privy to a lot of the stuff that they have, nor that we don't want to, but there is that gap that we have to somehow bridge of how do we flow necessary information back and forth without violating the veil of HIPAA, which is extremely important. And the privacy of all of those that we work with is very important, because that's a part of their recovery. And in the bottom line, in any of this, I don't care if it's substance abuse, mental health, homelessness, recovery is what we're looking for. And recovery is, we don't get cured, but we do recover. And that's what we need to keep focusing on, is recovery.
Well, I appreciate that, because I was having a hard time explaining it. I'm sitting here staring at the number one with social service providers, and I know it's complicated and there's overlaps, and that's why these are pretty surface recommendations. I think it was, again, a group of 50 people in our community came together and identified 10 needs, and it's incumbent upon us to figure it out. But it's a starting point. So are there any other questions about the top two?
Councilmember Holman, and then I think Councilmember Hall still, you have the mic. Councilmember Hall, go ahead.
Okay, thank you. Yeah, I just had a couple more questions, but this is a really interesting and robust conversation that I'm glad we're having, because it does sound like we do have some models that you mentioned, Lieutenant Bryant, with the continuum of care and with the Cleveland County Mental Health Task Force. We have some models that seem to be working fairly effectively, that if we do want to move forward with connecting maybe even those things with what we're talking about now, because I agree nobody wants to go to another meeting, but I'm really intrigued with what we already have in place, and it would probably be fairly maybe easy isn't the right word, but to identify what's working and what isn't working, because I was also struck with your mention of the word collaboration and how important that is moving forward, and not to reinvent the wheel, but to take what's working and apply that to what we're trying to accomplish here. So just a couple of questions. You mentioned that we currently have 10 CIT trained officers. Did I write that down right?
No. We have 55 officers that are trained, patrol officers that are trained.
Okay.
I have 8 dispatchers, communications officers that are full 40-hour trained in CIT. Okay. 1 fire inspector, and our municipal court officer is also a CIT.
Okay.
And I'm also an instructor for CIT and for mental health first aid. So we have a lot of officers who are trained in that, and we have plans for more, and that will just continue. We will start offering crisis intervention team training in our academies. So our new officers coming out on the street will have this training. And so it's just, but it's a work in progress. It takes time. And so, yes, we do have 55 right now that are on the street.
I'm glad I asked. I don't know why I wrote the number 10 down.
And the other thing is there's not a magic pill. There's not one thing that's going to work for everything. So I would encourage all members of council to be very flexible and look at each problem individually rather than trying to put the same solution to every problem.
Then the other thing I was just curious about when you mentioned, along with the soft uniforms, that another approach is units on bike patrol. Do you happen to know how many of our bike patrol officers are also trained with CIT?
I do not have a breakdown, ma'am. I can get that and I can get it to you through Ms. Hall, but I don't have a breakdown, but I can get a hold of that.
I'm just curious because I thought that was an interesting idea too. And then the other thing that you mentioned is how important it is to adapt other programs that might have been successful in other places to adapt them to what will work in Norman. And I think you mentioned that the crisis intervention team training that you do use originated in Memphis. Did I get that right? Yeah. So do you have the ability to adapt that training to meet what you see as specific needs in Norman? Or is that a canned type of training program that you have to deliver the training as it's written?
The Memphis model of crisis intervention training is the gold standard for CIT, for crisis intervention training in the United States. At the University of Memphis is the CIT Center, and they are continually doing research, and CIT International is the umbrella group that oversees CIT not only in the United States, but in Europe, Australia, and China. So we have organizations all over the United States. They set a guideline out, and then the Oklahoma Department of Mental Health and Substance Abuse Services is the proponent agency in Oklahoma for CIT. So what they did is they set out, based on those guidelines, they put out a curriculum. And so the curriculum is very heavy in state law and kind of fits what we do, because so much of what we do in the mental health side, I can take someone into protective custody because of mental health issues, but we may end up having to transport them across the state because that's just where bed space is. And so having people all over the state of Oklahoma on one common set of languages, one common way of doing things. Now, we take that and then we say, okay, here's what state law says. Here's what our training says. Now we're going to apply that to the individual problems that we have. So we take, it's kind of like driving. We learn to drive. We all have the same state law that we go by driving, but then, we're in Norman now. So we have to adapt what we know and what we know is state law to know not to turn left going on Gray Street when you're coming out of the police department. You got to turn right. So it's the same way.
I believe that, the general model of CIT recommends like a 20%,
20 to 25%.
20 to 25% of your officers be certified, which we went in excess of that, outside of that, of having more officers trained.
So is that something that an officer can request to have that training, or how do you make those decisions?
The officer can request it. We have a requirement that all of our supervisors, lieutenant and above, are trained in CIT. And I think we have maybe 2 left that we have to do. The problem that we have is when we're getting into the training, and we host a school every year, and then I go around the state and I help teach. That's the deal where the officers from the different departments go around to the different places where we have the schools. So I may go to Ponca City with a Tulsa officer, an Oklahoma City officer, an admin officer, and we go and we work together to teach this class. And so getting people into it, it's a very, very full class every time, and that's statewide. So by having it in our academy, we're going to have a greater ability to teach our local officers more often than we would if we're sending them, you know, to Altus or someplace like that to do the course.
Okay. All right. Thank you so much. I really appreciate all that information. So it does sound like you have a national model that you are able to adapt or enhance with, as you mentioned, like Oklahoma state law and that
Right.
type of thing. You can
There's a document from the CIT Center that I will give to Brenda to send out to you talking about that.
Okay. And I really appreciate the suggestion about attending the Cleveland County Task Force. I'd really like to participate in that. So thank you for bringing that up. And
I'm building on that, Councilmember Hall. When is that meeting? Because our retreat might conflict with this. Yeah. When is?
Mayor, it's the second Friday of every month.
Okay.
that'll work. It's the 9th.
No, actually,
Yeah,
that is
it's
the
on
Friday
Zoom.
before.
And it's
Okay.
still virtual.
Well,
We
the
haven't gone
16th
back to in person.
Okay,
Okay.
well,
You
the
can make it
16th will
unless
be
you're
at our
driving down
retreat
to
all day.
Texas. County.
Now, if you're going to OU, Texas, you may not make it.
Thank you.
Councilmember Holman.
Thank you. Mine was really around the same lines as Councilmember Hall, really, that just clarifying about how our program started in 2004, and that was kind of based off the Memphis program that started in 1987. But since 2004, you mentioned that our may have been inspired by Memphis, but we've probably made quite a few changes in the last 16 years to, reflect our community needs. Is that kind of just correct?
That and CIT International as the umbrella group has continued to evolve the program. And I won't say change. Change, I think in this case probably doesn't do it justice. I think it's an evolution. And it's an evolution in a number of different things. Number one, as we understand more about the human mind, and if you think back 20 years, 25 years, 30 years, we didn't understand as much about the human mind as we do now. And taking that research and applying that practically in the field is very, very, very important. And these conferences and the training that we get and everything we get from CIT International and from the CIT Center tries to reflect that and keep that evolution moving.
Appreciate that. And I would definitely like to see an expanded effort for our officers, standard patrol officers that are interested in this training, maybe strongly encouraging them to do it. But I understand the limitations you've mentioned about space and classes and all that stuff. But any way that we could expand it locally with Norman and Moore, or anything we could do, I think, to get more of our officers that type of training, I think would be really beneficial. So I would love to see that. I appreciate the information. Absolutely. Thank you.
Go ahead. I'm sorry.
I was just going to add in, this program is great, and I'm glad we're all getting more information on it. But going back one slide, we talk about expanding the hours of the current mobile crisis service units. I think about the Daniel Prude case often with that recommendation. We have something in place, but it's Monday through Friday, 8 to 5. And so even if his family had known that, of the resource where they could call someone in a mental health crisis as opposed to the police, in Norman, it wouldn't have mattered because it would be after 5 p.m. So I think we really need to be mindful. And again, this is the beginning of these conversations, but mindful in that balance. So I'm glad that we have the CIT officers. Lieutenant Bryant, you're an asset to the team for sure.
Thank you.
Councilmember Patron.
Thank you. Which cities were studied by this committee? I've heard Memphis. What other models were looked at?
That's it. Like I had said earlier, it's on pages 4 and 5 of the report, but I totally understand if y'all haven't had a chance to send it out. My apologies on the confusion of that whole process. But the ones that we looked at, he mentions Memphis. Memphis was not studied. We looked at the San Antonio, the county, which for some reason I can't remember the name of the county, which
I
is not
remember
in the
that
list, but in the
conversation.
list, I'm looking at it. We've got Salt Lake City, Baltimore, Rochester, it is in there. Okay, San Antonio, St. Paul, Reno, Eugene, Springfield, which is Kahoot, and the Dallas Star program. So all across the nation.
Okay. I want to circle back to that Eugene question, but so I guess a question for Officer Bryant. So we're hearing that, and I 100% agree that the COC is just outstanding for dealing with homeless issues, and you're sharing that the Memphis model is for the policing side of dealing with mental health, the gold standard as far as you're aware and have experience over your many years. However, these two sometimes overlap. We may have a homeless resident who's experiencing a mental health emergency. So I'm wondering, in the conversations with the committee, if we've had these discussions about the overlap, and then just procedurally speaking, how dispatch would handle that. Where would they be care-wise funneled? I mean, how are we considering these two?
The overlap that you're talking about, when you're talking about the continuum of care, a lot of the mental health providers, particularly Central Oklahoma Community Mental Health, are members of the continuum. So it already exists. So we know that a large number of our homeless community has mental health issues, but not everybody who has mental health issues is homeless. So you have to take each individual in each case one at a time. So and that's why, and you asked about when we get calls, that's why I've insisted that we have dispatch officers, communications officers that are trained in crisis intervention. So I have 8 of those within our communications section here at the police department. So if someone calls in with a mental health crisis, then there's a very high likelihood that you have a CIT trained dispatcher already on the phone communicating with that person, or communicating in the field with a CIT trained officer. So we start the de-escalation and we start the problem solving process from the time the phone's picked up. And then that just filters out into the field. Once in the field, the officer has tools in their tool bag, and that's what we call them. We call them tools in the tool bag of what they can do. Under state law, if the person exhibits the necessary criteria that's in Title 43A of the Oklahoma statutes, then the officer has the authority to take them immediately into protective custody and take them to a facility for assessment and treatment. Where we run into where the game changer is the crisis teams, in the fact that not everybody exhibits criteria to go into treatment right away. And when you're talking with someone and you know there's an issue, but you can't meet that mandated criteria to take them into custody, then the mental health crisis teams are invaluable to come out, because now they bring not an officer looking at a set of behaviors, they bring a clinician who has an ability to diagnose in the field. And that's where the game changer is having that clinician in the field saying, yes, here's what we've got. And not only are you going to take them into protective custody, I'm writing the diagnosis paperwork now, and we're going to put them direct admit into a hospital. So that's where the game changer comes in. We don't have to wait and decide whether we have criteria or not. We have that ability to access clinicians and to get them into treatment very, very quickly.
And that is for under the COC, correct?
No. COC is a model for homelessness. Okay.
Right. So you're saying
Well,
we
so
have
when you're
that tool in our
talking
toolkit.
everything together, you're just talking a collaborative model. And so it doesn't matter what we call it. The continuum is called the continuum because HUD and the federal government says we're going to call it the continuum. We can call the model anything we want. The basis of it is it's collaboration. It's bringing all these different entities together, all these different disciplines together, and working together in a multidisciplinary environment to come up with an outcome. In this case, recovery.
Right. So I guess I wasn't clear about my question. I apologize for that. So when you spoke about getting a clinician out on site immediately,
Mhm.
who are you calling for that? Who is your clinician?
If it's a child, if it's someone 24 years of age or under, we call the Children's Mobile Crisis Team that Teresa Capps was talking about. That includes OU students, the works.
Mm-hmm.
If they're over 24, then that's where we have the problem in the fact that the adult mobile crisis team is not fully funded yet and only is available 8 to 5 Monday through Friday.
Okay, so that's where the major gap is there
Yeah,
for the model that you're speaking of.
very much so.
Okay, thank you for that. And then on the various different models that you all discussed in the committee, were there data sets that were available as far as, under this particular model, Eugene, Oregon saw X percentage decrease in use of force or X percentage increase in recovery services, successful recovery services, or whatever particular data sets that they may have been able to show how their model is performing for those communities?
I think there was there was a reduction in use of force, but I don't know the percentages. But that's been the selling point for CIT over the many years is the reduction in use of force, and that's in all 50 states.
Okay, if you all, and maybe that's a question for the mayor, but if you all did discuss those with with respect to the various different models, Mayor, could you get that out to us so that we can see what it's looking like across the U.S.? And then my final question is, I did want to discuss what were your, I don't know, I guess what did your committee feel like after having studied Eugene, Oregon, since, there's so much in the news about their program and getting glowing reviews. So how did you all feel looking at that program?
They didn't give glowing reviews of any of them, to be honest. I mean, we had them look at it and we spoke about the soft uniforms, which you'll see here. And then I did refer them to the oversight committee meeting where Councilmember Bierman went into it in detail, but they didn't recommend any specific model. What you're seeing is what they recommended. And so it's on us to identify the policing approaches. They just wanted officers with soft uniforms. They wanted the collaboration with mental health. So again, it's a high level recommendation. The hard work is still left for council, but this was to provide guidance. And I know we're focusing a lot on the police models, but there were 8 other ones. So that, I don't have much more to give on that you just see what we looked at, but the recommendation they got from it is there. Notice that it doesn't refer to a specific model. That's on us.
Okay, well, I just didn't know if you all had taken the time, like, I know you spent a lot of hours and I really appreciate the committee's work on this. I just wondered if that particular model had come up and what they liked about it, what they didn't like about it. And then just procedurally, one final follow-up question, sorry about that, is you mentioned that the dispatch officers, 8 of which, so hopefully one on at least every shift, is CIT certified, has that training. Do they then filter the calls to ensure that the responding officer is also CIT certified? So one of the 55 is going to be assigned to the call?
Every
Correct.
officer coming out of the academy has a number of hours in training in de-escalation and mental health law. So every officer has some training. Only the 55 has the full 40 hours of training. If it does appear to be a mental health call that needs a CIT there, then they are doing their level best to do that based on the other calls for service. Obviously, when you have a lot of calls for service, it's hard to juggle that around. But they do the best they can. Obviously with only 55 spread over 3 shifts for a town of over 120,000 people, that gets spread pretty thin pretty quick. So in a CIT call, and the other thing about CIT calls, they take time. And that's the one thing that we tell CITs, this is what we tell supervisors. When you put a CIT officer out there, they're going to be out there a while. It's going to take time to work through the call. And so they don't always, they don't go out there, well, we did this, we did that, we went back in service. It takes time to go through those calls to adequately do what we need to do with those consumers.
All right, thank you.
Councilmember Patron, I'll just add one more thing about why we didn't zero in on a model. It became very apparent that we had a lot of resources in our community, which goes back to, I think, the mobile crisis service unit that we already have, and the facilitate greater interagency collaboration. So I think in deciding the model that is the best fit for Norman, everyone needs to have a really good understanding of what's out there. And I think that was what we landed on essentially, because we do have great advantages with all those state agencies in our city.
Thank you.
Okay, moving on to the third one. I started it, but let's go back. Identify resources to reinstitute the Juvenile Intervention Center. And as I mentioned, I'm honestly not very familiar with this. So if you could tell us a little background on what it was and why it went away, then I think that would be a good starting point.
Yeah, the Juvenile Intervention Center sort of, I believe, started back in 1997 or with a grant, like all the other things. It's a 3-year grant, and it was seed money to get it started, and it got started and it ran pretty good. Along around 2009, the state started cutting back money that would go to Oklahoma OJA, and when they started cutting money, the city started supplementing the operations. And what JIC was a center where police officers could drop juveniles with criminal violations or status offenses off, and it was a lot quicker than waiting on parents to get there. We supplemented that for a while just through the city. It ended up at first, there was maybe us taking hundreds of kids there in the years when this first started. And as it went along, we took fewer and fewer. And around 2015 is when the police department took over trying to fund Crossroads Youth and Family to run the juvenile intervention system. At that time, we was doing $60,000 out of a seizure account. We did that for a few years and determined that that wasn't going to be feasible because we was going to run seizure dry, and there's no, you can't tell if that will ever be replenished or if anything will ever come back into there. So it wasn't a good funding source for that. So the last couple of years, we have not funded it. We take kids up to Pivot in Oklahoma City if we need a facility. We have come up with other solutions to diverting juveniles outside of the justice system, such as their parents, mental health services, substance abuse services, and such. So when I look at the Pivot numbers of how many people we transported there in the last quarter, we might have taken 4. So how we've come along since JIC has been gone, we've just adjusted and started working with other social service agencies that we had available to get these kids the services they needed without bringing them into the juvenile justice system unless we had to, and it was taking them to like a detention center side of it, or if it was taking them into custody with DHS for abuse or care needs, we would do that. But otherwise, we would divert it and help the family get the services they needed.
Okay, since I've been around and in tune, it's been under the police, and it's my understanding that since the numbers went down, the money that had gone to that went towards the homeless warming shelter. Correct? So it kind of
That is correct.
diverted
This
over.
last year, we used that money that would have went to juvenile intervention. And Juvenile Intervention Center, you know, it started when it was at that little house on Robinson Street, you remember? Well, it moved from there because they couldn't do it 24 hours, and they moved it up to the shelter off of Tecumseh. So we would take kids there for this, and we were still trying to help them fund that. But it was getting to where the lower number of kids we was taking, it was getting up to where it's $800 and $900 a kid that we would take in there. And their average stay was about 6 hours. So we just didn't feel that the cost was worth it, and we could find other options, which we did in Pivot, which hasn't cost us anything. And we did divert that money for the
How far away
warming
is
shelter.
Pivot?
Huh? It's up off of like.
How far away is Pivot?
It's in North Oklahoma City off Broadway Extension at about 36th Street.
Because, you know, being the third largest city in the state, it would seem like there'd be an opportunity to collaborate as a county, maybe work with more and have one further south for all the towns south of us again. But I was surprised at how often that came up as a resource to get our younger residents the resources they need without a long haul to Oklahoma City, which I'm guessing isn't very convenient, but also not putting them in detention. And I think that was why it kept coming up.
It was it is a good system. And the thing with Moore, all the local agencies was in on funding the juvenile intervention system here, and us and Moore was about funding it equally, about 40,000 each the last couple of years of it. And Moore has also moved to Pivot. They do take more kids up there than we do, but we have a lot more resources to divert them to here in Norman than Moore does in their city. So they use Pivot a little more than we do. But, you know, 4 times in a quarter isn't too bad.
Yeah. Well, I think council, if you wanted to explore this recommendation more, we would need to pull all the stats, I think, from Norman and just see the cost of it. But there it is. It came up a fair amount. And we could also survey the agencies that were involved with the task force and get more information about specifically why they wanted it, while we're collecting data about the cost and a number of residents it serves. So there's that one. Any questions about the Juvenile Intervention Center?
You have a couple of questions, Mayor. Start with Councilmember Holman.
Thank you. If I heard you correctly, Chief, that this was part of the Crossroads Youth and Family Services.
Yes, Crossroads Youth and Family was the people that we contracted with that did this, provided the service.
So, yeah, I think if I'm remembering now that when I got elected in April 2013, I think it was May 2013, before I had been sworn in, but Lynn Miller and Greg Heipel and I got a lot of emails that month because the county commissioners, I believe, were voting to discontinue funding at the county level for that service. And a lot of people went to the county commissioners meeting and asked them not to do that, but they did anyway. And then the city decided to pick up the tab, as you mentioned, and keep that going. So I definitely am interested in reinstating that service if that's a recommendation that people think would be a valuable use of resources. for Norman. And I would assume that the Moore Police Department probably doesn't like driving to North OKC either. If they had some other options, maybe that we could work with them. I would love to see that too. So, and maybe the county commissioners, in 2020 might be more interested in helping fund something like that than they were back in 2013. I'm not sure, but I appreciate that information, Chief, though.
A lot of it was state funding that was cut.
Okay.
Not just at the county level. And the reason Moore sort of went to pivot is like us, they was paying $40,000 those last couple of years, and going up to pivot, they can spend less than half of that. So they thought it was worth it financially.
Okay. Thank you, Chief.
Councilmember Patron.
I was just going to comment along those same lines too. When we were doing the homeless warming shelter, the youth shelter here was already closed. It was, I just don't want people in the community to think that we had taken, like, we closed one program that was for kids in order to fund a warming shelter, because that's not at all.
Thank you for that clarification. Yes, I'm sorry. I appreciate you clarifying that.
Councilmember Peacock.
Yeah, in regards to the intervention center, are there any special requirements that a building like that would need in terms of security or anything else?
When it was on Robinson and even up at the shelter off Tecumseh, they never had security beyond their own staff. If kids leave, they had stopped them before at JIC when it was on Robinson, but a lot of kids up at the Tecumseh place, they may stop them now, but they don't get in confrontations with them, and they will call us on anybody that is violent or causing an issue like that to deal with them rather than them having to deal with them. But they don't have security on site. They do, I'm sure, have to fall within some type of fire codes and things like that, or whatever facility they use.
And I guess, yeah, so that kind of answers my question. This wouldn't necessarily need its own standalone new facility. We could probably retrofit an existing building to kind of function in this capacity. So thank you.
I think that's all the questions for now, Mayor.
Okay, so with number 9, we've touched on this in a variety of ways. We need to do like an agency audit to see of services, not necessarily of finances, to make sure everyone's on the same page. Because it's not just like we don't know what's going on, but there were members of the task force who were like, oh, you provide that to other people in the task force. So I think before we start inventing the wheel, we need to go back in and see what Norman offers with the large variety of service providers that we have. So that was something that, again, because of the kind of surprise that we were getting when someone would throw out an idea, they'd be like, well, we do that. So we've got to find a way to better not only get our agencies to collaborate, but communicate the services to our residents that are being offered. So we're not duplicating services, because as we've seen, funding's getting slashed right and left from the state, and it's making it more difficult for cities to fill the gap, especially now with every city around the nation is feeling a financial pinch. But the last one is one I'm really excited about, and I touched on it earlier, about how a lot of these recommendations tend to focus on strengthening children, examining services, increasing communication with services to residents, but also community outreach. Now, I had known about the Neighborhood Alliance of Central Oklahoma for, I think, when I first ran for office, but it's always a financial burden, right? You can't take on anymore, and it would obviously be contracting for their services. But they gave a fantastic presentation, which council, the whole PowerPoint is in the presentation that I sent out to you. So it's very basic, but we have had conversations since then as the city with this agency to see how we strengthen our neighborhoods. Because as you know, especially Councilmember Hall, some neighborhoods are old enough they don't have HOAs, and we see a lot of that in East Norman as well. where, I love, they have a great line that, everyone deserves to live in a great neighborhood. And they provide training and tools and workshops and coalition building. It's a fantastic organization. And so I've asked Lisa Craig to join us tonight and tell us a little bit about her conversation to see where we're at and what that would look like as a cost, because we didn't have that information in the presentation to the task force.
Certainly. Thanks, Mayor. Yeah, I've had several meetings over the last couple of weeks with the staff of Neighborhood Alliance talking about what they could take from what they offer the city of Oklahoma City and right size it for the city of Norman. And what we've kind of come up with is that, they've come up with a couple of objectives that they would like to work on with us. First being able to organize neighborhood where local people can solve local problems. And, the whole thing about Neighborhood Alliance is about neighborhood organization. A lot of people don't realize the difference between a POA, Property Owners Association, and a neighborhood association. They do a very good job of being able to explain the difference of those. It's not uncommon that a neighborhood could have both of those. A lot of the older neighborhoods don't have POAs. There's really not common areas that have to be maintained, but a neighborhood association does help with the organization of the neighborhood. And again, it goes back to kind of what Carrie was saying is the communication within the neighborhood. And so they would be able to come in and work with the city of Norman and the neighborhoods become established so that the people within those neighborhoods know how to react to issues within their neighborhoods that a lot of times the city really doesn't need to be involved in. Another thing is that they would work with the city to help Norman citizens find out what they want out of their neighborhoods. That's a really big open-ended question. Getting different meetings, helping set up some organizational structure within the city to better communicate to the neighborhoods what the city can provide and can't provide. And then it would be educating the citizens on how the municipality works and how they can utilize it to benefit their needs. One of the things that the staff talked about in the presentation is that they do a Code Enforcement 101, and it is a roundtable discussion, and it's not just code enforcement. It's almost like this is what the city does. And people that sign up for it have the opportunity to move between tables and tables and find out what it takes to rezone a property, or what your options are when your neighbor doesn't mow the lawn, or how do you get that road fixed or get the street light fixed. And that's one of the most attended things that they offer in Oklahoma City. And most importantly, the one thing that they would really want to start with would be to do a Neighborhood Leaders for Today intensive civic leadership program for Norman citizens. And it's a application process, and it almost turns into kind of a train the trainer. I think it's a several month-long process of evening meetings, meeting with, not only city staff, but the staff of Neighborhood Alliance to educate people on what it takes to be a neighborhood leader. And then that becomes just an annual process that happens each year. And I think we all know that as these leaders become trained, the excitement starts to build, and over and over and over, it just multiplies. So, they do a lot of different things with the city of Oklahoma City, both with the municipal government and specifically with the police department. We're still kind of refining, what their proposal is, but right now we're looking at, they would be providing a dedicated staff support overhead and things like that to help us kick this project off, to begin to better engage the citizenry of Norman within their neighborhoods and with the city. So any questions?
Councilmember Hall.
I think it might be more of a comment than a question, because I think I've watched Miss Craig in her work with the Community Development Block Grant Program take a stab at some of these things that we're talking about when she holds neighborhood meetings once a year for the boundary area of those neighborhoods involved in the Community Development Block Grant Program. So this is something that I'm extremely interested in pursuing, especially in Core Norman, where it's highly unlikely that you have the option of a POA or an HOA. There are a lot of informal and formal neighborhood associations already operating within the core. So I have seen the direct value of neighborhoods who are organized and in community with one another. And even during the pandemic, how these neighborhoods have been able to reach out to one another to just kind of check and see how they're doing. So I find great value in pursuing this and look forward to working with Ms. Craig and the rest of the city staff and seeing how we can move forward with a more formalized relationship. So I want to thank you for pursuing it.
Councilmember Holman.
Just echo some of the same comments as Councilmember Hall. I absolutely appreciate all the work that you do, Lisa, and would just kind of touch a little bit on not only do we have some older historic neighborhoods or in the core area that don't have HOAs, but we also have some older subdivision neighborhoods like Eagle Cliff, south of Highway 9, for example, that it may have had one years ago, I'm not sure, but it's definitely defunct. And I get a lot of emails from people that live in Eagle Cliff about issues like this that you just mentioned, and don't really know where to turn to other than to their city council member or the city to answer a lot of these questions and stuff. So I'm definitely very interested in that specific bullet point as well, based on a lot of the same comments that Councilmember Hall did. So I appreciate it, Lisa. Thank you.
Thank you.
Lisa, was there a ballpark number they could give us?
I have a ballpark number. And so what they had was, kind of a rough sketch of 3 to 4 workshops on how to organize your neighborhood, officer training, trying to do a small neighborhood grant program that we could do with some CDBG funds, as well as the Leaders for Tomorrow, the Code Enforcement 101, various focus groups, community gatherings, and then talking about having some other educational things on legal issues for HOAs workshop, maintaining private waterways, private roads workshops, how to open communications in your neighborhood workshop. All of this, we're looking at a little bit over $100,000 for their staff support.
Annually.
We had to pull this off.
Annually.
And what we
Okay.
talked about was, this is something that in mine and Georgie's thought is that we need to jump into this with both feet and get it rolling. And then it could be that as this, the neighborhood leaders for today really take off, then Neighborhood Alliance could kind of pull back and it would be a little bit more self-sufficient as far as their support.
And I would want to wait to institute this until we're not in a pandemic. It's harder to, I think, be successful with a lot of these initiatives, but that we have time. And again, I think council will be wise to not rush into any final decisions right now. But I was very excited to have the opportunity to discuss this tool and this option in the task force and share it with you. People were very, very keen on it. It's a great way to invest in our community and strengthen it from the ground up and hopefully affect lasting change through that. So Ms. Craig, thank you so much for working on that and getting more information. And I'm sure I can speak for council when I say we look forward to hearing the final proposal when it's ready.
Thank you.
Councilmember Bierman.
Thank you, Ms. Craig. I just wanted to also kind of put a plug in as someone who is business partners with the former Ward 5 City Council member. I could write a whole white paper on rural neighborhoods out in Ward 5 that also had HOAs that helped maintain their rural private roads. And they no longer have these HOAs and their roads are falling apart. And it is very difficult to figure out plans or ideas in how to resolve those issues when there are not good ties that bind these neighbors. They live on large acreages, and it's very unclear what their role is supposed to be, considering there is supposed to be an HOA, but there isn't. And they have rural roads that are also not under the city's purview. So I know there have been quite a few issues out there with gates being thrown up on private roads to prevent neighbors from accessing parts of their property. There are roads that wash out in the rain, and heaven forbid any of them have a medical emergency. So anything we can do to help people all over the city, including in rural Ward 5, better connect with each other and help to problem solve some of these things, I think would be helpful. And it will also help us when the next pandemic rolls around. This is very similar to the pod idea of neighborhood pods to provide some mutual aid to each other. And I think that this pandemic has really showed the need to better connect with your neighbors. But I think that this idea could have a long-term benefit outside of policing as well, in just creating better neighborly connections to help us the next time a natural disaster rolls through, or a pandemic, or the next thing that 2020 will throw at us that I don't even want to give an idea of what that might be, because it'll come true. So I really love this idea, whether it continues as a part of this conversation of reimagining policing, or whether it becomes its own standalone thing, because it has so many implications and applications to so many issues in this city. I do think that this is one that we should press on with at some point. That was it.
There are no other hands raised right now, Mayor.
All right, building on what Councilmember Bierman just said, Mosaicos is a fascinating program that is a collaboration between an organization called Latinas Win, Latina Women in Norman, the University of Oklahoma, and Norman Public Schools, also supported by the Smile Education Foundation. And that PowerPoint is also in the packet that I sent out to council. And so why I wanted to mention that, because it's another way, I think, to build up families and community, and hopefully, and why we mention these things, for us, it did have a link to reimagining policing, because we were hoping to cure the whole disease, not just the symptoms later, if to kind of help explain where we were with that and why it's included here. And so for those at home who, I'm sorry, this isn't in the slideshow, Mosaicos is a program that's in elementary schools. And the first one was at Truman and Truman Primary, and had 109 students. So, and it deals with Hispanic Latino children. From the total district enrollment in 2019 was 16,289 people. Of that, over 2,500 were of the Latinx community. And then basically it helped not only the children with extra programming and that kind of mentor relationship, but it helped the parents. So there was a connection where the parents were able to have resources as well and get them in the community and make sure their kids had the same resources as everyone else. And I will say it here, as I said in the group, I love Truman. It's a great school, but I can think of several other elementary schools in Norman that could use that very same program to help support, not necessarily our Latinx movement, but at-risk youth. And then so CCFI was involved. There were lots of opportunities to explore that. But I hope you enjoy the slides. And Ellen, are you on? I can't see with my screen sharing. Ellen Kraft?
No, she's not with us.
Darn, I knew she had a conflict. I sent her the link anyways, but review the slides. This would be an amazing opportunity to support children in all of our schools, especially that tend to have lower income neighborhoods with it. And so if we were going to again, the collaborations are huge, but it does specifically target the Spanish speaking communities. And I think if we're going to invest in it, it would need to be more than just the Spanish speaking communities. But it's been a huge game changer in student success, which is another way to end cycles of poverty and I think strengthen our community from the ground up. And so that's why we put those two together. So want to put it out there for conversation and communication. I would love to see if we were able to provide some funding to expand that into our schools, just because that was something that the task force was just very passionate about, and it was an excellent presentation. So feel free to review that. I know that Miliadis, she's a founder and I think president emeritus, and Ellen Kraft, who's also on the Human Rights Commission, I would be happy to answer any questions that you have, including what it would look like to expand on the collaboration and move it to other schools and the cost of it. Because I think we are so uniquely positioned with the state mental health resources, even though we would like to fund them better, and the University of Oklahoma and building outreach programs like this, and the Neighborhood Alliance of Central Oklahoma already existing just to bring it out, that again, we could strengthen the community from the ground up, and hopefully reduce the need for the police department is kind of was the goal and the vision with that. So any questions about Mosaicos?
Councilmember Hall has her hand raised. I'm not sure if it's about.
Yeah, it's not about that. It's something else. So I'll wait till we get to the end. Thank you.
It's your turn. That is the end. So I hope you enjoyed the kind of breadth of the recommendations. We touched on better communicating services, collaborating. I like the physical hub. I think that would be a key piece. We talked about, legal aid was involved, having office hours of sorts, so you could always know where to find them in a central location, and also get help from other resources, the resources to strengthen the community, and of course the conversation about the police department. But what I was trying to stress in our emails was it wasn't just about that, and that the recommendations come to you now. Thank you. As a council, we get to decide, how this works, but there is something that should be clarified. Ms. Walker, there is a lawsuit pending. About these funds. So let's just be honest about where we're at with that and what that means going forward.
Sure. We have had one hearing that I think I emailed you all about to update you on back in August. We were assigned a judge out of Carter County in Ardmore who comes up here to hear the case. He definitely recognized the urgency of this case and this decision for council and for the FOP. And he made time on his calendar to have a trial on the case on December 10th. Which is unusually quick. So we will, I think, have some more information in December. But until we have that settled, that's all about the funds that were diverted from the police department budget into other programs. And so my recommendation would be, as I've communicated with you all before, is to wait to spend that money until we get an idea of what the outcome of this trial may be. I know it may be subject to appeal, but I think we'll at least have a better idea of what that timeline could look like in December.
Thank you. And one thing I kept reminding the task force about is our dreams and hopes got bigger and bigger. It's $865,000, which is not a lot, minus what is specifically earmarked for the auditor position. So we've got big plans. And I love that. I think all of them will improve quality of life for residents in Norman, but it's really not a lot. We just need to be mindful about that. So, and we are kind of on hold until we figure out that fate. So I'm happy to, continue conversations elsewhere. Just please keep that in the back of your mind. We can't actually do anything until we get the final answer.
So I guess my final question, I was going to ask about the pending litigation. So thank you, Ms. Walker, for clarifying where we stand on that. But I think you noted several times, Mayor, that we just got this report, and I think it's 59 pages altogether late this afternoon. So I think we've raised a lot of avenues of future discussion, and I'm really looking forward to digging in to the report a little bit further, because none of us have had the opportunity to do that. I'm also wondering if these meetings were recorded, or if there are any minutes or any other documents that came out of the meeting that we might be able to use as a resource.
I believe there were minutes that were taken by management partners. Again, since my frame of mind was it was just kind of like a roundtable discussion to get us started on the next steps. It wasn't a formalized procedure. And since you all get to make the final decision, I was happy with, again, the well-rounded kind of approach they presented. So the goal was just to provide you with options. And half of the 59 pages, for what it's worth, is the slideshows on the Neighborhood Alliance and the Mosaico. So there's that. There's also more information, the summary of participant organizations. So you can see who they service and clientele and whatnot. So, but again, it's just a kind of starting point to continue the conversation about what we want to do with it. So I've let the task force know this is by no means guaranteed, but they were happy to share, again, a vision and hopefully some guidance from the 50 different groups that were involved.
Okay, thank you.
Councilmember Holman?
Thank you. I do definitely appreciate all these recommendations and would like to work towards them, including the upcoming budget for FYE 22. It'll be, voted on in June, but start the discussions. That's what we told people that came to the meetings, the budget meetings, that a budget is a year-long process, basically, and that if we're going to make changes, if we're going to redirect resources to things, that we needed to have a long conversation about it. And so trying to figure out, based on these recommendations, and in my opinion, regardless of the legal case, we have a large city budget, finding a way to fund a lot of these recommendations, if not all of them, through some way in our existing city budget somewhere. So I would definitely encourage us to continue working towards those despite the legal case. And then I definitely do, well, part of my intent is definitely to reduce burden on the police department. If it's 97,000, around 97, I mean, we could just say about 100,000 calls a year is, from what I understand, the police department is responding to. And we know that not all of those calls need someone with a weapon to show up that has the training that the police have. And maybe identifying if it's 1,000, if it's 5,000 calls a year that maybe some other entity is responding to that is trained differently, or I'm not sure exactly, but trying to relieve the burden on the police department, because it just a rough math, it's something like 600 calls a year per officer. If every officer in the department, every patrol officer, was responding to calls 7 days a week, if they were like all on call at the same time 7 days a week, it's like 606 calls a year they'd be responding. I don't know. But trying to reduce the burden on the police department with that number of calls, identifying, as Councilmember Bierman has talked about, if there's other resources that can respond to certain things that maybe the police are not needed or required at that particular call. So continuing to work towards things like that is definitely my intent. So I wanted to make that clear as far as the police resources stuff. And I definitely do like a lot of this. I'm looking forward to reading the full report that we got and giving some feedback after that. So thank you.
And on that note there, and what I told the task force too, is I was reminding them, it's really not that a large amount of money, but there are things we can work on now. We can start looking at, attending the meeting that, what was it called, Lieutenant Bryant? It's been a long day. The one you were second Friday.
Cleveland County Mental
The
Task.
Cleveland County Mental Health Task Force.
I would encourage everyone on council. I attended Continuum of Care meetings before I was mayor just because I was interested in it. I mean, you can attend these things and see for yourself. And so I encourage you to do that if your schedule allows, but we can look at ways to collaborate. We can start looking at our website to see how we better communicate services. And those are things that don't cost money, that came out of these task force recommendations. So, and I, again, don't want to add one more meeting. I think we touched on that, but there is better communication needed, not only between the public and the agencies, but cross agencies based on what was observed. So perhaps at the retreat, we can go over these again briefly, but look at ones we'd like to move on now that we can, and go from there.
Councilmember Foreman.
All throughout the day, I've had a bunch of constituents kind of raise some concerns and ask me some questions. So I'm going to kind of speak on their behalf. Daryl, can you answer how much did we pay management partners for this?
I've seen 2 invoices for $5,000 each to date.
The 10,000 in total. So I came on a council after this happened, so I kind of inherited this. And no one in the city has actually ever spoken to me about this task force. I only kind of heard about it through the grapevine, and we didn't get a list of who was on it until last week. And they'd been meeting for about 3 months, and council didn't even know who was on it. And when I saw the list, I don't recall any names on there of people that came and spoke at that June 16th meeting. And so I have some concerns that this hasn't been open to the public or even to council. And so I was just wondering, because, I'm a new counselor, I'm inherited, this defunding, quote unquote, issue. If I'm going to vote on something like, I think it needs to be very involved with the public. This is something that's considered very radical. We're the only city in the state of Oklahoma that did that. We're only a handful of cities in the whole nation that have done this. So I think before we even consider as a council moving forward, that we hold many, many public discussions, as it's a great deal of their taxpayer money to do that. So do we kind of have a time frame? I mean, obviously we know that there's some pending litigation, but are we going to have town halls? Are we going to go as hard at this as we did on the park tour thing? Because I think it's really, really important, because this is something that's going to affect every single person in our community. And I think everyone deserves a seat at the table. So those are just some of my concerns. And then just on the one thing on the soft uniforms, to the chief, it makes me nervous for every party involved, for the person in crisis and for the police officer to not have less lethal options on them. I don't know if you could do something with like a 511, because you could put like an expandable baton or some OC spray in there, but that's just, that's something we're talking about down the road, but that would just be something that I would want considered, because I wouldn't want, if someone's in a crisis and the only option the police officer has is a gun, I think that's, that's not good for anybody involved. So that's all.
Well, I'll jump in, and thank you for all of that. And I apologize for not communicating earlier. This was never seen as like, this is what will happen. I have multiple roundtables that one of them I inherited, one of them I started, and I was hoping to just kind of give us more information in this journey and continue to have the meetings that you're talking about. I mean, we kept adding members to this task force, and it got to a point where it wasn't manageable. And so there were some people that were invited to participate that declined. So I definitely want to continue the conversations, and hopefully at the retreat, it'll be here before we know it, Thursday, summer, by the way, we can talk about the next steps. This was just more information. Like I said, Councilmember Bierman did an excellent job and spent a lot of time looking into cahoots. I want to help as well, and this was seen as a way that I could do that. You can take or leave what you like, but I'm still very proud of the, I think, well-rounded approach that it added to the conversation. So it was one more tool in the toolbox, I think, as Lieutenant Bryant said.
Councilmember Bierman.
So I share some of the concerns brought up tonight. I would, if management partners has access to minutes, I would really like to see them, because I do think that it's hard to vet recommendations if we don't know the perspective that the committee had. We don't know how the information was framed. We don't know what values they used to judge the information being presented to them. And how information is presented and discussed is important. How topics are framed is important. The centering marginalized communities in this discussion is important. One of the things I didn't hear mentioned at all tonight was race. And that was one of the big motivating factors that led us to make the decision that we made in June. And so, I mean, I know that we had organizations that participated that reflected some of that, but I don't know how central to any of their discussion that was, or really any marginalized community. So I think that that's really important. And if management partners has access to it, I would love to see them. And I would also love it if all of our city committees were recorded, especially now that we're doing so many of them by Zoom. I really don't understand why they're not. Or maybe it's just the file's too big to be shared by email. If so, I'm happy to bring a flash drive. But I think especially right now, I don't see why we're not recording everything. So that's kind of my thoughts on that. But I really think the first step to me, outside of the lawsuit, is determining if the organizations that we currently have operating in our community are capable of and or willing to scale up their services. Some may be at the maximum capacity that they can handle, and they may not want to really scale up any further than they are, and be kind of trusted enough to be utilized by the community, because that's something that I've gotten a lot of feedback on. And this is not making any kind of personal assessment of any of these organizations, but some of the organizations that were included in this, I think that they need to face some truths about themselves. There are some communities within our city that do not trust some of the organizations that participated in this task force for a variety of reasons. They're not all the same, but there are some organizations in our communities that seem to have some weak spots when it comes to certain marginalized populations that we have. And I don't know that I can really make a qualitative assessment of whether or not the community is underinformed about the services we have, simply feel that they don't currently meet the needs, or feel like we need to go in a completely different direction. So I would like to continue this discussion far more publicly than we have. I did some initial investigating in the oversight committee and got a lot of really good public feedback before that meeting, during that meeting, and afterwards. But I really think that we need to get as much information that the committee was presented with so we can better vet these recommendations, and then start reaching out and actively and intentionally reaching out to the public to get feedback. We talked about that in oversight committee 2 months ago, about utilizing non-traditional creative ways to reach out to communities that are typically disconnected from City Hall. Because the typical surveys that are posted to the city's Facebook page or emailed out, many of our marginalized communities are just not connected enough to City Hall to be expected to participate in that. So what are ways that we can go to them? Because I think that that's really important, to be intentional in our outreach to some of these communities that we're looking to serve. So I really appreciate there is a lot of detail in that report that I truly just had an opportunity to just kind of skim through. So I appreciate having that, and I'm looking forward to diving into it. But some additional context of what the committee talked about and how they framed their discussion would be really helpful. And then, I think we can talk later this month and, over the next couple months about how we're gonna eat this elephant, because it's certainly gonna have to be one bite at a time, not just because there are very diverse recommendations in there, but also because our funding is limited. So I think that there are creative solutions to some of these things. I had things that were brought up in my oversight committee meetings that were not included in these recommendations. So I think that there's a lot of really good stuff to go around, and I'm looking forward to starting that process. But I agree, this is just the start. So I look forward to seeing where it goes from here.
I'm not seeing any other hands, Mayor.
All right. Well, thank you for your comments and your feedback, and Teresa and Lisa and Chief, Lieutenant Bryant. I appreciate you all being here with us to help cover some of these, and I look forward to the next steps. And again, it's just the beginning of the conversation. And to the task force members, thank you again for your time. I really appreciate it. Over those 5 meetings, it was a very great experience for me. And again, it was like the round table where I was hoping to be able to help out and share some information, and hopefully we were able to do that tonight. So I appreciate everyone's time. And with that, this meeting is adjourned.